Hi, I'm Suzanne. I'm a clinical psychologist in Obs and Gynae Health Psychology with Northumbria Healthcare. So Obstetrics and Gynaecology Health Psychology is a small service of psychological staff embedded in maternity and gynaecology services in Northumbria, and we work with women and couples who are experiencing emotional difficulties related to pregnancy, childbirth, pregnancy loss, or to a gynaecological condition. The Birth Reflection Service is a Northumbria service for women or couples who have delivered with us, and it provides the opportunity to talk through your birth experience and ask any clarifying questions about the process or decisions that were made. The additional thing about the Birth Reflection Service is that it's a whole pathway service, so it means that every woman or couple can access whatever part of the pathway they need. So it might be that some women need referral onto us in health psychology, or that some women need a conversation with one of the medical consultants, but it's an entirely bespoke service, so you're able to kind of go through the pathway in the way that suits you best, in addition to or instead of talking with the midwives about the kind of the clarity of what happened through your birth experience. So Birth Reflection is an entirely self-referral service, and any woman or couple can refer themselves from 6 weeks postnatal, so long as you have delivered within Northumbria Healthcare. And to refer yourself, if you just put into a search engine Birth Reflection Service Northumbria Healthcare, it should be the first result that comes up, and you just work your way through the form, and your birth partner is very much able to come through the service with you as well. If a woman or couple have experienced a previous traumatic or difficult delivery experience, in a future pregnancy, a couple's needs can become as much about their psychological needs as their physical needs. And women will talk to us about feeling so overwhelmed with anxiety related to their past delivery that they're not able to fully think about what their options are in this delivery or this pregnancy. So one of the things in terms of coming through health psychology that we try to support women to do is to find ways to be able to manage and unpick the anxiety that they're feeling, so that they're able to engage in helpful thinking and conversations with their team to be able to make the birth choices that feel best for them, rather than just purely driven by how anxious they're feeling. In terms of whether it's normal to feel anxiety in pregnancy, the short answer would be absolutely yes. Even without a previous difficult delivery experience, for many reasons, it is an incredibly emotionally vulnerable time during pregnancy. And many women, we've got a bit of a motto in our service that the whole perinatal experience can be the absolute best and absolute worst of times for women and couples. Aside from the kind of the physical changes and the hormonal and body changes, it's such a time of absolute uncertainty and transition, whether that's in terms of your relationship, your support networks, financial implications. There's just so much change, as well as thinking about maybe how we've been parented, how we might choose to parent, and things that maybe might not have been an issue pre-pregnancy suddenly do feel quite unmanageable. So it is absolutely normal to feel more anxious when you're pregnant. If you've been referred to health psychology, or you've referred yourself, which is an option, we're really focused on women being in the service that's the best place to work with them. So if that's a bit uncertain to start with, we'll have a conversation with you or the person who referred you to just try and work that out together. If we agree together that we're best placed to work with you, generally what would happen is that you'd get a letter confirming that we've received the referral. We'll have our contact details on it, and it will just confirm that you're on our waiting list. When you reach the top of the waiting list and we've got an appointment, we'll get in touch with you to arrange it. And that initial appointment, often women choose to have it face to face, but if you prefer, we can offer video call or phone call if that's better for you. Generally it's about 45 minutes long, and we'll just start to try to understand your circumstances and what you might need and how we might be able to best support you. If it is decided that we're not best placed to work with you, that will be because we're not in the best position to meet your needs. So we're a very specific service, as you might have gathered from what I've described, working with women specifically around their pregnancy experiences in Northumbria. But it might be that there's another service we've got that really good, what we call pathways, with our local mental health services and the perinatal mental health team. And the idea being that between us, we need to understand which service is best able to meet your needs. So it might be that the outcome is that because of our conversation, because of your previous experiences or another mental health service you might be involved in, it might be that one of those other services are best placed to work with you, but we'll always support you to access whatever service you need. If you're coming through the NBAC clinic, it's absolutely not essential to be referred through to health psychology. It is your choice in discussion with perhaps your midwife or one of the consultants. And essentially, if we can support you to be able to think through your birth choices so they're not driven by anxiety or a previous traumatic birth, and that's what we're here to do, but it is entirely optional. So wishing you all the luck with the rest of your pregnancy and with your birth choices. We're here if you need us.